Well, good evening, Windsor residents, families, friends, and team members. This is Angie, and today is Tuesday, September 8th, and this is your weekly COVID-19 update. I am going to start off by reporting just some wonderful things. We have had, I think, a pretty great week here at Windsor. As I announced last week, we did reopen the Veranda restaurant last Tuesday, as well as the Ashby restaurant last Thursday for kind of our new and improved socially distanced dining. Back to being cooked to order from the main kitchen. And I think after a night or two of hiccups in each area, we are just having a wonderful time. And I can see it in the residents, I can see it in the staff, that everybody is just feeling so much better about getting to spend more time together in kind of a more normal way, kind of how it was before BC, I guess, before COVID. So just had a great time last week being able to be a part of that process with the team and with the residents, and it just really has me feeling excited and looking forward to the future, and just kind of that light at the end of this COVID tunnel that we've been in for so long. So I hope that many of you are feeling the same way, whether you're residents or maybe you're hearing some of that feedback as family and friends to the community, and of course as team members. I think many of you have been enjoying that kind of change of pace, if you will. So just really good news there. In addition, we had probably my favorite day in 6 months yesterday. We had a Labor Day barbecue, and kind of last minute last Friday, we looked at things, looked at how we were going to be planning things, and we decided that we would add entertainment to the lineup. Something, again, that we haven't been able to do because we haven't been able to have visitors in the community since March. But we went ahead and did it. Cece found a great entertainer. Chef Aaron and Kel and Shelby and all of the amazing team members from food and beverage really worked hard to bring us an amazing day with amazing food, friends, music. Granted, we did do the club barbecue outside with music, but by the evening time, rain came, but the village residents got to enjoy the barbecue at dinner time. And of course, the the neighborhood residents even got a little private show of the musician in the Mosaic Garden. So I think all things considered, it was a wonderful day. I didn't make it up to the villages yesterday evening, but the staff were so excited to report a couple and two other residents actually came out who hadn't been out to the Ashby restaurant yet, and it was just an amazing day. It just has the staff so excited, and I think the residents too. So thank you all for an amazing Labor Day barbecue celebration. Thank you to Kel, our amazing sous chef, for being our pit master, bringing your smoker and letting us all enjoy your talents. Yesterday, I think, if I heard that was best brisket I've ever had, the best ribs, the pulled pork, everything was just wonderful and amazing. Not an empty belly in the house. So it was just a great day. And, for every resident who said, wow, Angie, this is like the good old days, or this is what Windsor's all about. We had some residents who moved in during the COVID quarantine, and this was their first true kind of Windsor experience. And it was so wonderful to see them finally get that experience of what they've been waiting for. So I'm so hopeful that we can stay healthy as a community and continue on this road of kind of reopening. We have been very cautious through this process. Residents have largely been exceptional in terms of adhering to the COVID safety protocols that we've put in place for even these more socially distanced kind of reopening opportunities, like the restaurants, the barbecue yesterday. But I'm just hopeful that all of us working together and being very aware of what's going on and maintaining our kind of commitment to those COVID protocols, that we continue to be a healthy community and get back to more of the norm that we all grew to love and certainly to miss here over these last several months. So I hope that everybody's feeling good and feeling excited about things to come. I know I am, and I know I needed it, and I think most of us did. So hopefully that gave us a little bit of hope as we move forward and kind of on this new track. So couple things we'll get into before we get in kind of to the bigger topic of the evening, which is this executive order that Governor DeSantis signed last Tuesday. But real quickly, let's just kind of run through the normal updates. In terms of COVID activity in the state of Florida, we are still experiencing a higher number of cases than anybody's certainly comfortable with. We've had a few higher days. I think it was 1,800 today. Which is obviously better than where we were, 2 weeks, a month ago. So we're glad for that. What we're really looking at right now with schools having gone back mid to late August, with the Labor Day holiday just happening yesterday, we're really going to be looking at how that's going to be affecting the general case count in the state of Florida, as well as the number of hospitalizations and, of course, the number of fatalities as we move forward. So while we are optimistic because we have seen a downward trend in the general case counts, we've seen a downward trend in the number of cases in senior living. In fact, the number of cases for or the number of communities affected in the state of Florida right now is just about 1,100, I believe, which is significantly down from where it was at its high point. So again, all things that are pointing in the right direction. But as I have actually been reminded by many residents, which has been a little surprising, is Angie, yes, but we want to be sure. We don't want to do things too fast. We've made all of these huge sacrifices as a community, as individuals, and as families, and we don't want to be hasty in our decisions to reopen. So please be mindful as you consider this and make decisions on our behalf as the community of Windsor, how we're going to proceed. So that's been very, very interesting and has certainly been in my mind as we've been going back and forth about where we go from here. So nonetheless, we will get into that. We'll get into that topic. Just a reminder to residents, we are going to have a September 11th tribute. We are going to do two tributes. We're going to do the first starting at 10 a.m. in the Stetson Lounge for our village residents, and also one at 11 a.m. in the Veranda Restaurant for our club residents. Now, please remember, at this point, we're still keeping levels of care separate from one another. So we have our club residents in club areas, our village residents in the village areas, and our neighborhood residents in neighborhood areas. So please, village residents, attend the 10 o'clock tribute, and club residents, please attend the 11 o'clock tribute. But CC has been working on a program for that, and last year I know it was amazingly moving, and I do know that we have a couple of residents here in the community specifically that did lose children in the 9/11 terrorist attacks, and we will absolutely do our very best to pay tribute to those individuals, you as residents, your families, and of course all of the Americans that lost their lives that day. So I hope you will consider joining us for those events. All right, flu clinic time. We do not want a flu outbreak during a COVID pandemic. So please, please, please consider getting your flu shots. We also make them available for all team members at the community at our cost. And again, we want to make sure that we are providing our best chances as a community of remaining healthy, whether it be from COVID or from flu. If you are a club resident and you have not yet filled out your flu consent form, here's one flu consent form. I have my name on it and phone number. I guess I should make a little bit more progress by the 10th. Please get your consent form back to Linda. If you are a village resident, Ali and the nurses will be working on these with you. And if you are a memory care family, please make sure to get your consent form or your declination form back to David, Ali, or myself so that we can make sure that we follow up appropriately. Our goal is 100% participation. Of course, we know that is unlikely. We do have a couple of residents with allergies, etc., but we do hope as many people who can take the flu vaccination will do that. And of course, they will bill that. Walgreens Pharmacy is our partner for this year's flu clinic, and they will bill your insurance or Medicare as appropriate. And of course, it is free to staff, as I mentioned. That cost is borne by Windsor. Okay. Leftover safety. We talked about this a little bit last week. I just want to continue to remind residents that we really encourage residents not to keep leftovers in their refrigerators, on their counters, etc., for any more than 3 to 4 days, as there will be a higher potential for foodborne illness, and we certainly don't want to see any residents getting sick from keeping things in their apartment. Please reach out to your server or your housekeeper if you do need assistance in cleaning out your refrigerator or getting rid of any old items. We just want to make sure that we help you keep a safe environment in your apartment. Of course, right now, there are no to-goes from the dining room. You can do carry out, we will deliver, but you cannot take doggy bags from the restaurants to home as part of our COVID-19 safety protocol. So just a reminder there. I am working on Chef Aaron for the opportunity to take a little ice cream home if you don't eat it in the dining room, but no leftovers, nothing that's been handled in the dining room to go home. All right. We continue to work with PS Salon to identify a new stylist for us. I think we are close. We do need to get that person through the background screening process and COVID testing, COVID tested, of course, before they can come to the community. So hopefully we get that person in place before we have anybody needing a color too badly. I know a lot of people got caught up on beautification when Cynthia is here. So hopefully we'll get that resolved sooner than later. Traveling event cards. Today is Tuesday. I keep thinking it's Monday, but that was yesterday, Labor Day. Tomorrow is Tuesday. We had a really great traveling cart, or it's a terrible name, traveling event Wednesday last week. We had a luau, and I hear there were some pina coladas that were well enjoyed by many. Had a low turnout in the restaurant for dinner that night. I think everybody had to maybe take a nap. But nonetheless, this week we are celebrating America. So I know Cece has some fun things planned with Emily, Ashley, and Gina Lisa tomorrow. So do check that out. And of course, the traveling event will find residents in all the common areas in the village, as well as the club, and of course, make a stop in the neighborhoods as well for the residents. Just a reminder to residents and families, we know that residents are going off-site for different appointments, visits, etc. Please, 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 residents, when you are outside of Windsor, inside of Windsor and outside of Windsor, please do wear your mask, okay? We have seen residents coming back from appointments and such with family members, and nobody in the car has their mask on. So it's really important, especially when you're in those confined spaces, that you have your mask on at all times. I know it's not comfortable. I know it's kind of cruddy, but it's so important in terms of keeping our community safe. You know, we have a lot of residents that have decided not to go out and about because they are so focused on not contracting COVID. And of course, we respect those individuals, and, you know, we have to go out and do certain things, but we ask that you really do take those precautions, because we know it is our staff and our residents, obviously, and vendors that may come into this community that will potentially bring COVID into our building. So we need all of those individuals, myself included, of course, to be wearing my mask at all times when I am not socially distanced from other people, whatever situation that might be in. But encourage the people around you to wear masks as well. So if you're going to go out of the community, you're going to be in a car with somebody, we get it, but please do wear your masks and try to practice social distancing as much as possible. I don't think it's going anywhere for a while. Even with the vaccines they're talking about on the horizon, I do think we're going to be married to our face masks. Yeah, I even brought I got an Alzheimer's week, or an Alzheimer's awareness mask, so I can, you know, always accessorizing, getting ready for next Monday, Memories Matter Monday next week. So nonetheless, please, please, please wear your masks. Speaking of Memories Matter Monday. Next week is a national week across the country. It is called National Assisted Living Week. And as you know, a part of our community is licensed assisted living. Both our villages and our neighborhoods offer licensed assisted living services. So this is a week where we will celebrate our residents and our staff in the community. And it will be a celebration of all of our residents and our community as a whole, and all of our staff and our community as a whole. So we look forward to seeing you next week and participating in a number of festivities starting off on Monday when we have Memories Matter Monday. We encourage everyone to wear purple head to toe, as much or as little as you can. And we are going to kick off our fundraising for the National Alzheimer's Association Memory Walk. So we hope you will join us in that endeavor. We have a really interesting opportunity this year in that there isn't going to be a Central Florida walk in Orlando. Rather, individuals are going to be doing virtual walks. So we will be doing our very own walk here at Windsor, and are really looking forward to, turning those lemons into lemonade and having our most successful Windsor Alzheimer's walk yet. So plan on learning more about that next Monday. Tuesday, we're going to be doing Tranquil Tuesday, which will be all about relaxation. So we'll be wearing our most relaxing attire and our PJs, and having some fun there with some different smoothies and just all kinds of fun stuff. Wednesday is going to be, I got it, hold on. Here it is. Weather the Storm Wednesday. How appropriate is that? I feel like we have been weathering a big storm since March. It is dress and talk like a pirate. So, what is a pirate's favorite letter of the alphabet? I bet you said R, but it's not. It's the C. What do you think? That's my best dad joke. That's my husband's favorite joke. I'm sorry. Okay. Teamwork Thursday, so represent your favorite sports team, your favorite team, whatever it is. We're going to have a lot of fun with that. Kind of jeans and jerseys for staff. And then Friday, we are going to be celebrating Most Fortunate Friday, because goodness gracious, in all of this, the storm that we've weathered this year, we certainly are most fortunate to be together here at Windsor. Daytime is going to be Windsor Pride. We are going to celebrate some things like our new logo, if you haven't seen that, our Revel in Your Retirement logo. And then Friday evening, we're going to do a formal dinner. As formal as you'd like it to be, of course, but just a reason to get dressed up and celebrate and have some fun. And Chef Aaron is working on a wonderful menu for that event. But that is September 14th through the 18th, Assisted Living Week. Again, find reasons to celebrate. That's what we do. Okay. Let's see real quickly. I just want to make sure before we jump into the topic of, let's talk club credits really quickly. There have been some questions in terms of club credits here as we've rolled out our new club menu specifically. Now, just to clarify, our residents in the villages and in the neighborhoods, because we are assisted living, there are a number of regulations that we adhere to. And one of them is providing 3 meals a day to our residents that live in the club and the villages. So, the villages and the neighborhood. So those residents that live in those areas, they get to have 3 meals a day. 3 meals a day from the menu, okay? Whether they're 18 club credits or 7 club credits, whatever it is, you get 3 meals a day. We don't keep track of that. In the club, however, our residents get 30 club credits each day that are provided to them on the 15th of each month. So if it's a 30-day month, you get 900 credits. If it's a 31-day month, 930. If it's a 28-day month, I'm not going to do the math, but you get the drift. So each item on the menu has a value of club credits. So I think there's a little confusion because for the first 2 years, maybe a year and a half, we used a system called virtual dollars. And the issue was people kind of thought virtual dollars were equal to real dollars when they're really not. They're essentially about 4 club credits translate to our $1 of cost. It translates directly to food cost, okay? So that's how we figured out that math. So every resident gets 30 club credits a day, and you can do that with what you like. You might eat dinner in the restaurant 4 nights a week. You might eat it 7 days in the week. You might not like dinner. You might just do lunch or breakfast. You might do breakfast one day and dinner the next. Nobody gets to tell you what you have to do and how you have to do it. And that was our goal. A lot of retirement communities out there have a system in place where you just get 1 meal a day, period. And you have to use it or you lose it. Or maybe you get 30 meals a month and you have to use it or you lose it. Most residents use it for their big meal of the day, but essentially it's 1 meal a day. There's other communities that do something called a declining balance, which is pretty similar to what Windsor does. We just do it with credits instead of dollars because our credit amount is higher than what you usually see in a declining balance system. But nonetheless, you do get to carry over your credits up to a 1,800 club credit balance. And we do have the opportunity when the restaurants reopen again to use some of those club credits for guest meals, of course. But use them as you'd like. You can get your big meal of the day, or like I said, any combination of. But I think most residents are enjoying the new menu. It is our reopening menu, so we do plan on adding some things very, very specifically in kind of the center of the menu in the entree area, as well as maybe some flatbreads and some street tacos, but also some meatloaf, some chicken parmesan, some things like that, more in like the 17 to 22 credit range to have some more mid-level entrees, because we do want residents to be able to get their big meal of the day and a few other things during the week, as well as those big dinners they want to have. And of course, our menu ranges from I think it's 9 or 10 club credits for a large entree salad. Up to, I think our highest credit option right now on the menu is usobuco with veal served over polenta and succotash for 38 club credits. And of course, all of the entrees come with soup or salad. So it makes for a pretty hearty meal. Actually, I was worried because our dessert orders have been down. So I went out to talk to the residents and I said, is it because you don't like the desserts? Is it because the club credits are too high? And they're like, no, Angie, we're just full. So if you can get chef to let us take our dessert home, we're ready to do that. So a good sign nonetheless. So that's just a little bit about club credits, as I know there were some questions about that. Okay. Last things last here, let's talk about this executive order that Governor DeSantis signed last Tuesday that I'm sure everybody saw on the news and in the Sentinel, that assisted living and nursing homes are open for visits. Well, thank you. But there's about 11 pages of, where is it? I've got my executive order here, or I did. But it's about 11 pages of requirements that we have to meet in order to safely and acceptably implement the new visitation executive order. Now, I will say that if you read the executive order, what we are doing right now with the drive-through visits does meet the requirements of the executive order, with the exception that we do need to provide some additional education to residents and families that you sign off on. We do need a liability waiver signed. So there are some other things that we do have to do, but what we're currently doing is within the recommendations of the task force that the governor put together in regards to safe reopening of long-term care communities visitation. So That said, what I think we're going to do, because of some of the cautious nature of the residents, and very frankly, the cautious nature of Angie, is we are going to hold steady on our drive-through visits until September 29th. And I'm going to tell you a little bit about why we're going to do that. First things first is we had testing today, and we will finish tomorrow for our staff, and we will have that testing by the end of the week. Okay, so the requirements communicated in the executive order say you can't have had any cases for 14 days. Okay, so we've got our testing going. Okay, good. In addition to that, as I mentioned earlier in our video here, is I have some anxiety about what's happening in schools. Granted, example, my kids are home doing launch ed, so they're doing virtual school, but I know there are cases in at least my daughter's elementary school. I have heard from other staff that there are children in their children's schools that are on quarantine. It is an issue, and it isn't one necessarily being talked about like the issues in senior living were being talked about early on. But I know we have a lot of family members that are teachers or in contact with teachers or small kids that are in schools. And I do have an amount of anxiety about that in and of itself, that I think it's just a little premature to kind of open the physical building for visits. In addition, we know what happened after Memorial Day in Florida, and we know what happened that continued after the 4th of July holiday. And I do have a level of concern about what the impact of the Labor Day holiday is going to be. So we are targeting the 29th of September. We'll have our testing back from this week, and we should have our testing back from the 22nd, which is our next test date. Okay, now, if we have positive results in either of those, that can and may affect our implementation of this plan. If there are any positive cases on the 22nd, it will affect our plan. So we are going to continue to have to be flexible and understand that we're going to work towards this and we're going to plan, but it could change if we have a positive result of a resident or staff in that time frame, or a presumptive positive, etc. We are planning to do inside visits, 30-minute visits in identified areas of the community. Now, the executive order, we wanted to do them in the lobbies. We thought that would work out real well. And then as we read the executive order said it had to be in areas that other residents couldn't necessarily access. So they had to be private, but at the same respect, and I'm sorry, but we have to do this because we're being tasked with this, is we have to monitor the visits. So we're trying to identify areas in the community where the visits can be monitored that aren't accessible by other residents, but we can also give you a feeling of privacy while we do what we have to do. So there's a bit that's going into that. So right now we're thinking about the gathering room for our neighborhood visits, the Iris private dining room for our village visits, and potentially our Florida room, private dining room for our club visits. And that's just where we are right now. It's a lot of written processes that have to be put in place. There's cleaning schedules, as I mentioned, there's education. These visits are going to be by appointment only per the executive order. So we will continue with the Sign Up Genius regimen. Our plan is we will do the drive-through visits exclusively up until the 29th of September. On the 29th of September, barring no changes in our COVID status, we will do drive-through visits in the morning as scheduled between 9 and 12. Tuesdays for the club, Thursdays for the neighborhoods and the villages. Okay? The change is going to be in the afternoons We are going to do indoor visits, 30-minute visits. These are still going to be no-touch visits between the hours of 1 and 4:30. So the first visit being 1 to 1:30, 1:45 to 2:15, 2:30 to 3, 3:15 to 3:45, and 4 to 4:30 on Tuesdays for the club. And this is going to be tough, but it's got to be first come, first serve. And we know everybody's going to want to be first, etc. But it kind of is what it is. We're going to do our best. And then on Thursday, we will have the same slots available for the village residents and the neighborhood residents. Okay, so we'll maintain those visit days of Tuesdays and Thursdays because, again, we have to monitor the visit. So somebody's got to be there, be along. We've got to do the screening. We've got to do the temperatures. We've got to sterilize the areas. Between each visit, we have to monitor during the visit. There's a lot that is going to go into this, and we are going to do our very best to make it comfortable and enjoyable and private to the extent that we continue to do what we need to do as the provider or the business standpoint. So that is our plan. We are working on potentially doing plexiglass dividers in each of these visit areas, just so that we can have a little less anxiety about if the mask slides down or, all of that kind of stuff, just to put another safety measure in place. Please know that if you are in the community for a visit, you can only a resident can only, for the in-person visits, your visitor must be at least 18 years old or older. No one under the age of 18 can come in the building per the executive order. We also have to limit your use of the community. So please use the restroom before you come and after you leave. We are not going to be able to allow residents to come to be moving throughout the community. That's going to be a really important part of the containment approach to visitation. Okay. So 2 visitors at a time, and we are going to make sure that everyone has an opportunity to get a visit before we start rescheduling people. Okay. That is going to be really important. We may try to see if we can get a second venue as well for each of these areas so that we can have more visits at once. So we're still working through some of these things, but I am firm at this point on the date, September 29th, to start in-person visits, barring no change in our COVID status, okay? So I will continue to provide updates on that, on my Tuesday video updates, as well as my Friday Angie's notes and anything in between as appropriate. And I'm hopeful that we will be able to kick this off without a hitch. I do want to point out, and I hate to say this, but it does need to be said, while we have had a tremendously positive experience in terms of the drive-through visits, we have had some kickback from residents and/or families in terms of our safety protocols. I do need to let you know that the executive order does explicitly say that I have the right to revoke in-person visits if the resident and/or family is not adhering to our safety protocols. Please don't put us in that position. We absolutely do not want to have to do that to anyone. We are so excited about the prospect of reuniting our residents and families outside of a car, but we need your help to do it safely. We are all in this together. We have been since March 13th, and we just need each other to get through this safely, and we're trying to make the best decisions to do that, but also to bring a little bit more balance into the lives of our residents and families here as we go forward. So that is the update at this point. September 29th, signups for in-person visits. At this point, the signups will open in Sign Up Genius as of the 21st of September. You will not be permitted in the community if you have not made an appointment for an available time slot. These are no-touch visits. You will be monitored very closely by staff. You will be screened. You will be escorted to and from the visiting areas. We need masks on at all times. We'll need you to sanitize your hands properly upon arrival and before departure, when leaving the community as well. So there will be an extensive protocol in place. And again, we will just need everybody's help to do that. If you have any symptoms, have had any exposure to any person with COVID or presumed positive of COVID, please cancel your visit immediately. And this goes, of course, for drive-through visits as well. But also, if you have had a visit within prior few, 10 days even, of you developing symptoms, being positive for COVID or presumptive positive, please notify us immediately so that we can take the appropriate measures to notify anyone that might have been in contact with you. Okay? It takes a village, I guess, in all of this. But if we can get all of this done, I think we can plan for some good visits and some good quality family time. Max of 2 individuals per visit. The executive order says each resident will get to identify 5 people on their visitor list. They can only have 2 visitors at a time. 5 visitors total, 2 visitors at a time during your 30-minute visit. The following visit, you could have another 2 people. The following visit, you could have that 1 new person, an old person, or any of the 4 before, but no more than 5. And I think that's all about risk mitigation, minimizing the number of potential exposures, I guess, by limiting people. 2 people max, it is what the executive order says. And again, no one under age 18. If you're on the fence, we might card you. So that's what we got to do. All right, this has been a long video. I know the residents like it when I keep it about 20 minutes or so, and we are 37 minutes in, so that's pretty long. But I did want to provide an update on the time frame for implementing these in-person visits. They will not be in apartments, just so you know. They are in common areas within the community. The executive order actually reads a couple of different ways, but what I'm deducing is the only time visits can happen in the resident's apartment is if the resident is unable to get out of their bed, is bedbound. And we don't have really any residents that hit that criteria unless, unfortunately, they might be in hospice or going through the dying process, in which case our compassionate care visitation comes into play, which we have been offering since the beginning of this process. So all visits will be in common areas. Now, in the chance that you are truly unable to visit Tuesdays and Thursdays during these time frames, as we have previously, please reach out to Cecilia and we will work on seeing if we could schedule a visit during an alternate time. And that's for residents and families who work, who don't have vacation time, who are unable to take off early, get off late, etc. I mean, some people have those really tight situations, and we certainly want to help be part of that solution. So, keep talking. Without further ado, that is about it for this evening. Please look for Angie's notes, and I will send out communication to follow with everything that we've talked about tonight in writing for all of the residents, families, and friends to kind of digest as we move forward. So that will all be outlined in Friday's Angie's notes. Okay? Well, that is it for tonight. Everybody have a wonderful evening. Stay safe, stay healthy, wear your mask, and let's keep moving forward. Hopefully no steps back. All right, everybody, have a great night.